Hi everyone. Thank you so much for signing up to help us call back patients who were found to be positive for COVID-19. My name is Dr. Sheila Young and I'm currently the site director of our COVID-19 testing site at Charles R. Drew University of Medicine and Science. Some of you might be well-seasoned physicians and will have no problem completing this form and talking with patients. Others of you might be students in either our medical school programs, physician assistant programs, or our nurse practitioner programs. If you're a student, we ask that your preceptor would look over the work that you're doing in calling people back. So they can either be on Zoom with you, or they can be with you in person, of course maintaining social distancing and wearing a mask. So in some of the cases, patients are called back without us keeping any information. What we want to do is be able to track the symptoms that the patients are having, and also to help determine whether patients who test positive have a medical home or have other needs that we can help to meet through our services here at CDU or through our partnerships with community organizations. So what I'm going to do right now is go through the script with you. Everyone will get access to REDCap. Now REDCap is a secure database that's widely used at many academic universities to collect data that is confidential. You will be given a Excel file with the patients that you'll call. Most calls take about 10 minutes. With our additional questions, they might add about 5 or so minutes to the call. And after you receive the Excel file, you'll also get a login, as I just mentioned, to REDCap. Once you log in, this is what you'll see on the screen. COVID-19 testing positive results callback or call log. This is the CDU, MLK, OPC, and LA County Fire Department program. So we're going to ask you to please complete this below. You're going to put in the patient ID. And again, that's going to be from the CDU MLK Excel file. You'll write your name here, where it says name of interviewer. And when you're calling the patient, you'll say, hello, this is Dr. Young. I'm from Charles R. Drew University of Medicine and Science, and you were recently tested at our test site. And before we provide you with your results, we have a few questions, and we'd like to also confirm that we're speaking with the right person. So am I speaking to Allie Jacobson? You'd mark yes or no. If I make a mistake, I can go to reset, and that question will be reset. Language. So we can ask, are you comfortable hearing your results in English, or would you like to hear another language? And they'll let us know what language they'll select. So you can either select English, Spanish, or other. Now, when you sign up for calling patients back, we have listed an area for you to mark out whether what other languages you speak. So we have English, and then the most common languages, additional languages that are spoken in Los Angeles County, such as Spanish, Tagalog, Farsi, Korean, or Mandarin. And if they say that they'd like an interpreter service, then you'd click here, and then you would call the interpreter service, and we'll provide you a number for that. Or if you speak another language, you can just mark here as well. And if we have other language, we're able to write it in here. So then we'll ask the patient their date of birth. You'll have that information from the Excel file. So did we verify? Yes, we verified. We'll also confirm their email address from the Excel file. Once we confirm their email address, we click yes. Then we'll also confirm their address. Next, we'll ask them their gender identity, and we click whichever one they let us know. And then we're also going to ask about your race or ethnicity. And so I'm going to click here. Then after that, we're going to let them know about their test result. Sometimes the patient has already received the results via email. And so we will let them know your COVID-19 test was positive. This means you were carrying the virus in your body at the time you were tested. So you're going to wait, and you're going to allow them to either ask any questions, or you're going to just allow that to sit with them for a moment. So with great bedside manner, again, we pause, we await their reaction. We address any emotions they might express, and we respond with empathy. I'm sorry to have to deliver this news. I'm here to answer all questions and concerns you may have. As you may have heard, many people are now affected by this virus. What do you know about COVID-19? So they'll let us know, and then we'll ask them, how are you feeling? If they ask about the coronavirus, specifically, we'll tell them about it, that it's a novel coronavirus. There are different types of coronaviruses, but this one actually causes a more severe infection, especially in people who have a weakened immune system that's either caused by an older or an advanced age. Other conditions like high blood pressure, diabetes, heart disease, lung disease, cancer, autoimmune disease, or immunodeficiencies like HIV. We'll let them know that most people who test positive for COVID-19 will have a mild illness, but other people can become seriously ill. We'll then ask them if they have a primary medical doctor that they can go to for services. So, do you have a primary care doctor, office, or clinic that you regularly go to for healthcare services? If they answer no, this pops up. If you don't have a primary care doctor or provider, we can provide you with an appointment for a healthcare assessment with a healthcare provider from the Martin Luther King Jr. Outpatient Center. We can call you with that information. And then we want to go on to ask them about some symptoms that should warrant them to be concerned and possibly go to the emergency room, or when they should go to the emergency room. So we would say, are you having any of these symptoms? Shortness of breath. So if you're short of breath walking to the bathroom or another short distance, if they're vomiting and unable to keep liquids down, if they're too weak to walk, if they have fevers over 104 degrees, debilitating pain, if they're passing out, if they're confused, have chest pain, and or abdominal pain, not just discomfort. So if they're having some of these symptoms, then we will essentially talk to your preceptor, or if you're a physician who is working in your own practice, you'll click yes, and then you will immediately refer them to call 911. One of the things that we don't want with COVID-19 and some of the things that we have been seeing is that patients are staying home despite having these priority symptoms. So anyone with shortness of breath, vomiting, or the inability to keep down liquids, if they're too weak to walk, if they have fevers over 104, debilitating pain, if they're passing out, if they're confused or have chest pain or abdominal pain, Also diarrhea, they should go to the emergency room right away, because these symptoms tell us that their body is having a severe reaction to the virus, and they can be in severe or critical illness if not attended to right away. So again, if they tell you that they have any of these symptoms, we stop the assessment and refer them immediately to either call 911, or we have them stay on the line and we call 911 and give the 911 operator their address. If they don't have any of those priority symptoms that require them to go to the emergency room, we ask them, so if we click no here, let's click no. So you saw if I click yes, this question pops up, emergency symptom referral, we mark yes. Okay, if we press no, then that goes away and we just have the next question, which is, please inform your doctor of your results. So we mark yes, that we're going to inform. And then if we referred them to MLK Outpatient Center, we click yes here. If not, then we click no. And then if they have no priority symptoms and no primary care physician, then we will let them know that we can give you a call back with a resource to address these needs. Then we're going to ask them about other medical conditions that they might have. So here I will blow this up for you. So they can have none, unknown medical conditions. They can be pregnant, have diabetes or high blood sugar, hypertension or high blood pressure, cardiovascular disease, heart disease, stroke, prior heart attack, chronic pulmonary disease like emphysema or COPD, asthma, chronic renal disease or kidney disease, especially for patients who are on dialysis, chronic liver disease like end-stage liver disease or cirrhosis, immunocompromised. They can have HIV, they can have autoimmune diseases, they can be on medication that causes them to be immunocompromised, such as Enbrel, infliximab, Prograf, Cellcept, if they are taking medication for an autoimmune disease or if they're taking medication post-transplant. Again, cancer or lung disease are other medical conditions that put people at a higher risk for complications from infection with COVID-19. And then if they tell you that they're having any depression or suicidality, or if they're having difficulty coping because they can't go out of their house, they can't do the normal things that they're doing, we can refer them to the Department of Mental Health Access Center. It's a 24/7 helpline, and it's 800-854-7771. Okay, and then next we'll let them know that they should get medical